Thomas Jefferson stated, "Knowledge is power." Most hospice executives would find very little shared DME information with even less context. Typically, there is little guidance on benchmarks, avenues to lower cost, or actions to improve patient care. This lack of information is reinforced by analyzing the huge regional variances in DME ordering and utilization. So let's take a minute to look at the top 5 variations. The first will be Group 2 support surfaces, also known as low air loss mattresses or power pressure reducing mattresses. These are used with 4 to 8% of the patients in best practice hospices, but they're used in 60% of the patients and higher in hospices which don't measure and enforce clinical care standards. The national average lands at around 55%. Number 2, we'll talk about supplemental oxygen usage, which is typically 30 to 40% of the patients in best practice hospices that use supplemental oxygen, but 60 to 100% in other hospices, the national average being 60%. Number 3 is tilt in space or Broda chairs. Average utilization comes in at just under 2%, although many hospices have 5 to 10 times that utilization rate for their patients. Number 4, bed and wheelchair alarms, which on average are used about 0.4% of the time, but many hospices use 20 times that amount. Lastly, patient lifts are used on hospice patients 1% of the time, but many hospices use 20 times that number. So why is there such high fluctuation in usage? What is your percentage usage? What is the right percentage for your patients? How might we improve patient care with knowing these answers? It has been said that benchmarking is the means by which an individual moves from the ranks of an amateur to the ranks of the professional. If your DME vendor or DME manager doesn't, or at worst can't, answer these questions for you using evidence-based criteria, then you need to find someone who will. Best practice clinical hospice managers know the answer to these questions. They have the knowledge and the power to affect better patient care. These are the clinical stars of the hospice industry. Unfortunately, the great majority don't know what they don't know. Do you know the best practice utilization percentages and how you rank for DME? Are you using this vital information and the supporting clinical evidence to improve your patient care? For more information, contact your friends at Qualis, home of heartfelt, intelligent DME solutions. Thank you.